Hi, and welcome back to another episode of the Breakdown with Bethany. I'm Bethany Braun Silva, and today this episode is all about the Black maternal health crisis. Black Maternal Health Week is April 11th through 17th, and today my guests are two women making groundbreaking strides toward maternal health equity by addressing institutional racism and disparities within the U.S. healthcare system. Porchia-Albert and Jennie Joseph are two advocates transforming the future of equitable healthcare. Chanel's organization, Ancient Song Doula Services, and Jennie's Commonsense Childbirth are working toward a future where everyone has the safe, respectful, and dignified care they deserve by providing the treatment they need to have healthy pregnancies and, of course, healthy babies. It was such an honor to sit down with these two women who are making these amazing strides. And of course, we need to keep having these conversations. We need to keep talking. We need to also keep listening. Jennie is declaring a state of emergency, and it's time to take action. So please take a listen to this episode and watch the two documentaries that we'll be featuring in an article on mom.com. This is a really, really important conversation and just one of many. Take a listen. My first question is actually for you, Jennie, because when I watched your film, I was really moved, of course, by your whole story. But then when Eilis, is that how you say
Yes,
it?
Eilis.
Eilis came on and talked about being a doula was really an exchange of energy with the woman and the babies that the families that you're working with. And I am familiar with what a doula does to a certain extent, but I think a lot of people still have so many questions.
Yes.
So could you take us through what a doula does and how this
Oh,
energy exchange plays into it?
yes. I think that's a really great question. I think we've actually run amok with doulas are the solution. Doulas are it. Well, actually, you know what? They aren't on their own because we can't change this situation that we're in as far as maternal and infant health with just one thing. It's got to be this whole interdisciplinary work. And what the general public still may be struggling with is exactly what a doula is and why is it different from a midwife, right? So a doula is a person that is dedicated to supporting the birthing person through the experience of pregnancy, labor and delivery, and postpartum. They do all of that support, though, in a non-medical way. So a doula isn't going to do a blood pressure check or a vaginal exam. A doula isn't going to listen to the baby's heartbeat, but a doula is going to check in with that birthing person and find out what is it that you need? What is it that you're looking for? What are your deepest concerns? Where are you struggling? How can I support? The doula can outline and help build out a birth plan, a pregnancy plan, a postpartum plan, care plans, can help with advocacy where someone may express, I have a real deep concern about, I have some abuse issues in my past and I'm nervous. The doula can help create structure and plans, language, role play, get people prepared to be able to advocate for themselves during the experiences, whether it's in the prenatal, maybe with a doctor visit, midwife visit, or whether it's actually in the labor and delivery itself. Doulas also educate on labor comfort measures, positions, changes. Doulas engage the partners and family members to support this birthing person and this birth experience by providing support for all the people in the birth team to be able to be their best selves, to be their fully expressed selves, to have their autonomy and their power. So it is really social support, educational support, emotional support, standing in the gap and meeting people where they are. Midwifery is all that and the medical actual delivery of care, whether it's prenatal care, measuring the baby, listening to the heartbeat, doing blood pressure, dipping urine tests, or it could be during labor and delivery, during the actual birthing process where a midwife is going to guide, support, watch for any complications, make decisions, help people plan, for the safest birth outcome. And in the postpartum, the midwife is obviously very hands-on again in terms of the recovery, breastfeeding, chest feeding, etc. So there is a demarcation line, but we got a little bit of a melee going on in the United States where everybody's like, oh, it's the same thing. No, it's not. But there is such a level in both disciplines of exchanging on a level that's not the typical medical exchange, where healthcare might have lost the care. Doula has not. Midwifery has not. Where you leave an appointment feeling maybe disempowered and not sure what happened or what was discussed, you won't have that experience if you're working with a doula or a midwife. Those are the kinds of difference where you are putting yourself into the interaction and working with the birthing family to really complete the experience and keep it whole.
Thank you. Thank you for making that clarification. And I will say that I sort of misspoke at the top. I know Elise is in her first year of midwifery school. That's
Yes,
what
she
she's
is.
in the documentary. So thank you so much for making that distinction. Chanel, hello. Hi. Thank you so much for joining us.
Hey, hey, Jenny.
Hey.
I'm so really I don't know if excited is the right word, but really just sort of like feeling energized to talk to you both after watching both of the films. Jenny was helping me understand, or really in our viewers and our listeners to understand the difference between a doula and a midwife. And I also, Jenny, if I can just go back to you as well, because the opening of your film in particular, it's really it was incredibly jarring because you're calling a state of emergency, and without kind of giving too much away, of course we want people to watch the film, and it is really a call to action. Tell us what you mean by that, about the lack of care that that the people that you mention they're not receiving. Why is this a state of emergency?
I consider it at this point, we're in a humanitarian crisis. I mean, we didn't have any problem naming the COVID-19 pandemic as such. We didn't have any problem calling out a public health state of emergency. Release the big guns, release the funds, release the extra folk on the ground, the first responders, you name it. We were in action just like that because that's what we do. We know how to do that. Why I'm calling a state of emergency around maternal child health, particularly maternal child outcomes that are impacting communities of color more disproportionately than any other community. I'm calling it out because we've been talking for too long. I'm tired. It's ridiculous that at this long, after this amount of time, this amount of research, all these years of hand-wringing, we haven't got any solution that is making such a difference that the numbers have changed. In fact, the numbers are worsening. And that is why it's time to declare this what it is. It is a public health state of emergency. It would not stand in any other country. We would have already deployed all of our best thinkers, our consultants, all of our measures that we do when we go overseas or wherever we're rushing to save the day. What is holding us back? And I think it is literally naming it and putting that level of concern on it. Yes, we understand this is a problem, but it's not a new problem. It's not even a crisis. This is a continuum. Never has it been that in America, you can be safe during a birth, pregnancy, birth, or postpartum experience, particularly where people are marginalized. It has to stop.
Chanel, I'm curious also what I think I might understand your take on it, but I would love to hear in your own words what you think of Jenny calling this, really naming it what it is, a state of emergency.
Well, I think it's exactly what Jenny says it is. I mean, I got into this work back in 2008, and that's the first time I met Jenny. And she was doing this same exact work then. And bringing attention and bringing focus and honing in on what the problem is. And I think what we really, it's a state of emergency, but it's also bringing attention to our healthcare infrastructure as it pertains to reproductive health in particular, and the ways in which it is just fractured. It's not working for, for people of color, for Black, brown, and Indigenous people, which also means that it's not working for white women either. And if it was, if we were in a different call and it was white women that were dying at the same rate as Black women and brown women, then again, Jenny would have had her state of emergency already, right?
Yep.
I've gone and I've spoken at, the UN Human Rights Commission in Switzerland. And, I say that what we're trying to do is bring basic human rights into the birth room, right? And the reason why we have to do that is because of the ways in which our system has systematically disenfranchised communities, right? Low income, high income, it doesn't matter.
Right.
It doesn't matter your educational level. when you are, a person of color, it is exasperated, and so we really need to, we have to highlight it and bring attention to it.
Right. And I know that you're both very entrenched in advocacy. And I know Chanel, it feels like a bit more of like a grassroots, really, boots on the ground community effort. But you did recently get a bill signed into law. So tell us about that.
So I was able to provide insight around a bill that was centered around doula registration, right? And so creating a registry for doulas who will be accepting Medicaid within the state of New York. And while yes, it is a grassroots movement, and all of these movements have come out of grassroots movements, let's just be clear. When we're talking about changes within public health, those have stemmed from community-based organizations that have been on the ground, who have witnessed firsthand what is happening, what's accessible and what's not, and what's really working and what's not, and have come up with solutions to address those problems in real time. And it is through the work of grassroots organizations and community-based organizations that these bills come into fruition. And so while, we people want to sometimes, shun or look at it as a smaller movement, when you think about it, it is where all of the legislation stems out of. And so, yes, I've worked on that bill. I've also worked on city, state, and federal legislation as well, and so it's having the opportunity to speak to the folks who have the ability to change the ways in which care is actually driven. And so the bills are great, but also we have to focus on implementation and accountability. And so if, we can have as many, high in the sky bills and, beautiful initiatives, but if there is no follow-up, if there's no community feedback loop, if there is, no accountability for when things go wrong, or putting things in place so that consumers can, voice their concerns, and providers have a space in which to be able to also voice their concerns without reprisal, then we're going to continue to see the same things happen over and over again. We're going to continue to see people come up with these bills and, all of this. And we need again, we have a healthcare infrastructure, a maternal healthcare infrastructure that is fractured. I can be in one hospital, there could be two hospitals, one across the street from the other. They have two different policies and the ways in which they're going to treat people, you know what I mean, and how they're going to see individuals. And while, care is on a case-by-case basis, there are some standard practices that people need to follow. And so we really need to start looking at how we're focusing and honing in on them.
Yeah. And I do understand, by watching these films and, the sort of little bit that I know compared to both of you, that, a lot of this work comes from trauma, comes from, personal trauma. Certainly a lot of the women that I watched, the women in the film who had incredibly traumatic experiences, and how both of you are working to make sure this really is mitigated in some sense. And what I also really thought was so interesting and important was that it's not just a practice, right? But you have trainings to train, to bring in other people to train. So can you tell us a little bit about how that got started, and how the women, or the potential midwives and doulas that come to you, what they're looking to learn and what they're looking to change?
Yeah, I just want to say first, so my work didn't start from trauma.
Oh, okay. All right.
I didn't come into this work based on a trauma experience. I came into this work because of the beautiful experience that I had with a midwife and a doula. It was a Black midwife and a Black doula who centered myself and my husband in our birthing experience and gave us the care and the reassurance and the fortitude to let us know that we're doing a great job, that, the decisions that you're making are coming from an informed place. And they really centered our care. And that to me was really, really important, coming into a space where I was a mother who didn't have a mother to ask questions to. And it was that midwife and that doula who were the cornerstones of that. And because of the care that they gave me, that is why I decided to become a doula and to get into this work. because I said, why don't more people know that they have the option to have this? That was what was, really startling to me. So I came from a place of having private insurance, having access to care, going to whatever doctor I want to go to, but still, you know what I mean? Like, it was the care from the midwife and the doula that was exceptional, right? And because of that exceptional care, I was like, oh, okay. Like, why don't we just know that we can go to them for care? Why do we have to go through all these loopholes to figure out something that should just be it should be right there in front of you to just know.
Right. And I did see that. And I do, sorry if I misspoke. I did see that in the top of your documentary as well, with the beautiful affirmations that you have your students repeat. So I do want to highlight the joy as well. And I think Jennie, if you could talk about a little bit, if you're okay, you did touch on a personal trauma that you experienced when you were 30. So, and how that sort of informed your experience going forward.
Yeah. And I mean, similarly to Chanel, I was a midwife 10 years before that happened. I started midwifery in my teens, trained in London, and I was joyously happy. I mean, I was a young idiot, in the club, living the life, but I was burned up with a passion and a calling to midwifery. And I was able to get in and get started. And I trained in a very busy London hospital, and I got an excellent training. And that's the grounding. I'm 43 years into midwifery at this point. I've never done anything else in my entire life. So I was called in and I was able to fulfill that dream. The American experience began with that trauma that woke me up to, could this possibly happen to someone who's actually in the field, who's actually knowledgeable, empowered, has agency? And the answer was yes. And the answer was yes, because I did not know the system as I do now know it. And also, I didn't realize it doesn't matter whether you had power agency or not if you are other. That piece, right? And so I think it's important. I mean, your earlier part of the question where you were talking about, asking about the training and why do people are drawn to this profession, these professions, what's bringing them in is oftentimes they realize it is unfair. It is egregious that this is like having a cure for cancer and saying, no, we're not going to use that. Let's not bother, right? Like when and they're very simple, many times, ways that mitigate harm to such an extent. And let's not forget, we talk about mortality and we have numbers for mortality, but we really don't have numbers for morbidity, for ill health, bad outcomes, disability, problems that stem from childbearing experience. We're not counting that. You're still alive. But when we really look at that in the cold, hard light of day, make 4 million births a year. How many of those 4 million are the same people after they've gone through that experience? So many. And I mean, I'm not trying to be dramatic, but could it be 1 million? Could it be 2 million? How many millions of people or thousands, tens of thousands of people post their birth experience are whole, are back to how they were before, are okay? If you just ask that simple question of people in the childbearing years, are you okay, sis? Are you doing okay? The answer isn't often, yeah, I'm great.
Well,
That's
yeah,
the problem.
and it also is in the conversation that I think we allow for mothers to have the fluidity to talk about, right? I mean, I'm a mother of 6 children, and when in certain ecosystems that I find myself in at times, the conversation is more freely happening, right? And it can happen in such a way where you can express like, oh, I'm having this mental health disorder, and you're not being scrutinized for it, or you're not, your parenting is not being questioned, or when you bring up a situation around, a physical ailment, or you go to an ER, you're being seen right away. But when it comes to, Black mothers, brown mothers, saying like, hey, this is how I'm feeling. This is what's going on, right? And then being able to trust individuals and being able to share that and not being penalized for expressing, well, this is what's happening to me, right? And what I mean by penalized, I should say criminalized for saying that, or not having your children taken away because you're having, you're going through a particular, mental health condition, or if you're experiencing a near miss, right? And now you find yourself back in the ER, being able to do that in such a way where it's also not putting your family at jeopardy, it's not putting your children at risk because you're no longer able to parent because you now are, you find yourself in a situation that you didn't want to be in the first place, right? You just want to have a beautiful birthing experience, go home, bond, be with your baby and be happy, and so a lot of the people who also take the training are individuals who are working within different systems, right? And so I've trained individuals who are social workers, who are nurses, who are medical residents, individuals who are lawyers, right? So that they can fully understand and get a grasp of, well, what is actually happening? You know what I mean? How can I better help you to advocate for yourself? Or how can I better understand the situation? And the best way I can do that is for me to get this training so I can understand what's going on in the birth room, what's going on during the postpartum period. What are the resources that are available? What's not available? So that I can help you to best advocate for yourself in a meaningful way.
I'm actually really curious about this because a lot of women that I've spoke to were told, probably wrongfully so, they couldn't work with a doula or a midwife because they were high risk, myself included. And so that is sort of it, but it seems counterintuitive, right? So I'm wondering if someone were to enlist a doula or a midwife and they're in the birthing room, and what does when a doula or midwife sees something blatantly wrong happening, or that their patient is not being advocated for in the way that they know they want to be, what does that now look like when you're within the system, a hospital system, when you're dealing with OBs and nurses and all the sort of administration that comes within that? So I'm just so curious to know what that sort of, I don't want to say conflict, but what does that look like when the doula or the midwife sees something blatantly wrong, but the OB is saying that it's not?
I'm going to go with, let's use the word conflict. Let's just call it what it is. And it's not just the midwife or the doula. Often it's the family member, it's the partner, it's even the laboring person themselves. This is an ongoing, okay, let me not say war zone, but it's a contentious environment more often than it's not. And it's because we have, unfortunately, territorialism, we have power dynamics, we have financial, we have all the sociological and then also the psychological, because both sides are traumatized, are harmed, are working out of fear. There's sense of, your job is at stake if you're on the professional side. If you speak out, if you don't speak out, if you join in, you've got risk management at the background, you've got the supervisors. There's an entire milieu of just harms across all. We do our training specifically to support the supporters, the providers, because they need such support at this level because of burnout, moral injury, frustration, fear. They are equally suffering under this broken system, as are the families, not to mention the doulas and the midwives. So there's a continuum of a cycle of harm. And again, I'm just going to go straight back to, it's a power dynamic. And until we address it from that place, we're not going to be able to mitigate it. It is the continual racism, the institutional racism, the historical racism, classism, discrimination, whether it's gender, othering. These baked in ways of being are underlying and undergirding a system that is obviously not sustainable, but we've yet to come up with how to break it down, and policy making isn't going to solve it until we can figure out the rest of it. It's got to be worked at, considered as a whole. And this is so insurmountable, it seems. It's not that we want to be negative and not have hope, but we have to be realistic. It's time to tell the truth about what we're dealing with before we try to deal with it.
Yeah, to Jenny's point, I think it's something that has to happen simultaneously, right? Because a lot of what providers are experiencing is, normalized trauma, or trauma that's become normalized behavior, right? And so half the time they don't even know that they are perpetuating harm, because when they first witnessed it and they were, upset about it, it was dismissed, or they were told, something, like, don't worry about that, just we got to keep moving, we have to go up to the next patient. And so just thinking, we have to look at our educational system. How are providers being educated? How are they being supported? We need to think about institutional policies and protocols. or how are they really set up? Are they set up to meet the needs of the patients that are coming in, or is it functioning as a business to get you in and get you out? And then we have to incorporate also legislative policy, right? And that is to hold the systems accountable for data collection, to make sure that they are that families feel like they're being supported. And when they're not, they have a opportunity to report that, right? And have those things followed up on. Because a lot of also the trauma that comes from, a birth experience is something happening to you and feeling like you have no way to release that energy, right? This has happened to me. I now want to say something, but who do I go to, right? Do I go to the patient advocate? Am I, doing a survey? Is it going to be followed up on? Or when there's a maternal death, oftentimes families go and they find themselves in situations where they haven't received any answers. No one knows what has happened, right? And now you have, either family members or someone who has to raise a child while they're still trying to advocate for, the parent who has just lost their life. And so we really need to systematically work out these things together simultaneously so that we can lift up the whole system in its entirety.
Yes. And it's so it's not funny. That's the wrong word, but it is so easy to kind of get bogged down. And I felt myself getting sort of overwhelmed by this sort of mammoth undertaking that I think, we're all responsible for, right? So, but I do want to bring it back to the joy, because there's nothing more joyful than bringing new life into the world. And you both said that in each of your respective films. So I really do want to take some time to focus on that, talking about the joyful experience of being a midwife and a doula, and also the work that you're doing within your communities, within the community as like Big C as a whole. So I definitely want to leave space for you to talk about all the joyful moments and what this work really means to you.
You go.
I love what I do. It's amazing. I came into this work centered in wanting to create space for moms and for children to be able to feel like they had a safe space to express themselves, right? For families to come together and to have their questions answered. And so when you see a family be able to do that, to center themselves, to affirm themselves, and then you see those children walking in the neighborhood. And I'm like, oh my God, like I was at your birth and you're like, you're like walking and talking and doing all the things. But to know like the triumphs that their mom had to go through in order to bring them into this world. There's one mom that I work with in particular who, she's in her mid-20s, her and her husband, she had insurance and all of a sudden her insurance ended. And she was trying to navigate care and where to go, and I was able to help her to just navigate insurance and, how to find a provider that was able to give her a happy medium. She didn't necessarily want to be in a hospital, but she also didn't want to have a home birth. So we were able to find her midwives who happened to practice in the hospital and offer like birthing center care within the institution. And she had a wonderful birth experience. And you never know how you're going to touch someone, but yeah, like, just seeing like those moments when, families, the joy and the happiness that comes from whether you have a hospital birth, you're at a birthing center, or you're at home, you should be able to feel like you're being centered. You know what I mean? Even if your outcome isn't necessarily the outcome that you wanted, but you feel like, hey, I was maybe able to make informed decisions. My family was included in, the process. Like I didn't feel like I was being taken advantage of. I felt like I was being listened to and heard, and, I was a part of my process. Like that's what it means to center human rights in action, and to center one's bodily autonomy. And when you see that, people feel that, and they feel affirmed about it. And also like they'll be like, listen, and a good name is better than gold. And so they'll refer out and they'll say, hey, like I had this person and they were amazing. And, this place did this, that, and the other. And it's just beautiful. Yeah.
Yeah, ditto, right? Like what gives me joy is Chanel and people, I mean, the hundreds the hundreds. We have grown. This is a movement, and this has grown so exponentially. And it is such a joyful feeling to know how many of us are out there on the front lines who have built out in our communities that are strengthening and bringing power back into this perinatal space. That gives me joy. It gives me hope because we are going to prevail. We've always managed to prevail. We're still here, right? Like this is how we got here. And we are now growing into the ability to really take back our communities, take back our power around this, and stand for ourselves, stand for everybody who needs support, ask for support, wants support, and be able to sustain that we are still here and we are growing. And that piece I'm like so excited about. This 20 years in, I was like, we're not really making any progress. And now we've hit critical mass. Here we come.
Love it. Final question for you both. What do you need from us? What right now where we're at in this space? What do you need from the nation, from the world to help support these causes? What would you like to see people do on a granular level and on a big level? Like how can people watching this can now take action in what way from your perspective?
Listen, get out there and just listen. The stories are there. There's so many stories. Your neighbor, your workmate, your sister, ask, are you okay? How are you okay? How was your experience? What happened? And we will build power in that awareness. And people know there's something going on. They just don't know exactly what. We have to keep sharing what's happening and tell the truth about what's happening. So I say, let's keep talking. Let's keep sharing. This is a grassroots up movement. All hands on deck.
Yeah, and I would just add to that, I grew up in a community where everyone looked out for each other, right? And I remember becoming a new parent for the first time and having neighbors that lived two doors down from me, and they were, an older couple. And as I had more children, they would bring us fruit and they would check in on us and they would offer an extension like, hey, how are you doing? And what we need is more individuals to realize that we're not separate from each other, that we are stronger together, right? As a community of individuals, as a nation, when we decide to think about one another and ask questions, right? So not just listen, but ask questions. Hey, how are you? What's going on? You know what I mean? While also basic things. If you know something, share it. Like, don't hoard information. You know what I mean? Like, if you find out about something, let somebody know. And, on a larger scale, community has the solutions. So let's work together to drive those solutions so that we can really center one another. It's not that hard. I think we make it harder than is necessary. But when we take an opportunity to just listen and really implement and follow through, I don't think there's anything that we can't do.
I agree. And Chanel, tell us about Ancient Song, just as a kind of like a wrap up. Like if you're in the New York City area or not, or even not, beyond, how can people find you and enlist your services or sign up for your training, all of that?
Yeah, so you can check out our website at ancientsongdoulaservices.com. You can follow us on Instagram at Ancient Song. We sign up for our newsletter online so you can find out what's going on. We host all kinds of educational webinars that are national. You can find out where we're going to be. We'll let you know, like when we're in your town, or if you want us to come to you. We are open we travel all the time. And so not just nationally, but globally. So if you want us to come and check you out, we're here.
I don't know if we're reaching audiences overseas, but it's a good message to my little podcast here. But Jennie, same question for you. For Commonsense Childbirth, how can someone get involved, get training, enlist your help?
Yeah, so ours is easy at commonsensechildbirth.org. You can find, we have 4 main branches of work. We have our clinical branch where we have the birthing center and clinics in Central Florida, but we are now accrediting clinics across the country, and we're growing that out where people are replicating our clinical model. We have a midwifery training school. I'm very proud of our midwifery school. It does 3-year midwifery training. It leads to a certified professional midwife, which is a national certification. We have a training institute where we train our doulas, childbirth educators, community health workers, etc., lactation support. And then we have the National Perinatal Task Force, which is our movement building body. That's a real place where you can land in terms of being active, whether you're working as a supporter, an amplifier, an igniter, or you want to open your own perinatal safe spot and provide care in your locale where you are open to being that safety net for the perinatal population in your area. We've got lots of opportunities for people to join in, including donating, volunteering, and just, championing our work. So commonsensechildbirth.org is how you find us. And welcome, we're waiting for you.
Thank you both so much for the time. I really, really appreciate it. And we will be sharing all this information with our audience and, of course, links and things with you as well. So I really do appreciate it. Thank you so much.
Thank you.
Thank you.